wonderful day yesterday and covered a lot of great topics, and we have a really wonderful program planned for you again today. And thank you, Charlotte, for going through some of the housekeeping rules for today. I wanted to introduce myself. I will be moderating this morning's plenary session. My name is Elaina Mule, and I do community development work here in Nevada for Charles Schwab Bank. And one of our pillars and priorities, and some of the biggest area of our work is affordable housing. And so we have been proud supporters of the Nevada Housing Coalition since its inception. And I have also been a proud board member of the Nevada Housing Coalition since its inception as well. And so we're really excited to be bringing you this content and hosting our first summit this year after a couple years of being a new organization. And so before we jump into today's program, I also want to recognize and thank our sponsors, especially our presenting sponsors, the Federal Home Loan Bank of San Francisco and Anthem Blue Cross Blue Shield, as well as all of our supporting sponsors. We are very thankful for your support and wouldn't be able to put on this program without that support. And we're going to open the day today before we jump into our opening remarks and our panel discussion with a special greeting from U.S. Representative Dina Titus.
Hello, I'm Dina Titus, your congressional representative from District 1 in the heart of Las Vegas. In southern Nevada and across the country, we continue to face devastating economic and public health crises from the COVID-19 pandemic. I believe that in order to get our economy back on track, we must first get the virus under control. In March, we passed the CARES Act, a historic relief bill that helped small businesses through the Paycheck Protection Program, sent direct payments to the public, and added $600 a week to unemployment assistance. The CARES Act also included funding for state and local governments to deal with the impacts of the pandemic, and I'm proud that those funds are being used to support the rental assistance program here in southern Nevada. I also want to thank Treasurer Conine and the Clark County Commission for spearheading the effort to get rental relief to the people who need it the most. Even before the pandemic, Nevada had the largest shortage of affordable rental housing in the nation, and Las Vegas had the most severe shortage of all metropolitan areas, with only 10 affordable and available rental homes for every 100 extremely low-income renter households. Housing is a critical resource during this time to keep people safe and healthy, and we must ensure people can have roofs over their head to help stop the spread of the virus. That's why I co-sponsored legislation to provide $100 billion in emergency rental assistance for up to 24 months for people, or to cover up to 6 months of back rent and late fees. And I've urged leadership to include this in any future virus relief package. While I'm grateful for the CDC's eviction moratorium that will allow people to stay in their homes at least through the end of the year, I know we'll need additional assistance to cover missed rent to prevent a disaster for both renters and landlords. So I won't stop fighting for you in Washington until we get the relief that would help keep people in their homes, provide the economic stimulus we need, and fund the testing and tracing required to get this virus under control. I want to thank the Nevada Housing Coalition for hosting this conference, and we'll continue to work with you as we recover from this devastating pandemic. Please call on us anytime. Thank you.
Thanks for sharing that, Charlotte. And next we're going to move into our opening remarks, and I am just thrilled that we have Treasurer Conine with us to offer those remarks here today. And we couldn't think of anyone more appropriate to open this morning's session, which is all about Nevada perspectives, because Treasurer Conine has been such an advocate and offered tremendous leadership on our housing issues, especially in the midst of this pandemic. And he's participated on other recovery webinars that we've hosted, and again, has just been a wonderful leader and a wonderful partner to the Nevada Housing Coalition. So thank you, Treasurer Conine.
Well, thank you for having me, and good morning to everyone. I'm Zach Conine. I'm your state treasurer, and for those of you who don't know what a treasurer does, usually it's not housing, but in times of pandemic and in times where we have a fundamental need for Nevada families, the governor and I wanted to make sure that we jumped in and picked up oars that perhaps we hadn't touched before. I want to thank the Nevada Housing Coalition for having me today. It's nice to see so many friends in this fight for fair and affordable housing on the line. A special shout out to my sister-in-law, Dorian, from the city of Las Vegas, who's on the line. Her husband and I both married deeply, deeply up. So our country and this great state were built on a framework of ideals: the ability to vote and have one's voice heard, access to clean air, clean drinking water, and perhaps most importantly, the idea that every citizen or resident should have a safe and secure place to sleep at night. From the state of the economy to the social determinants of health, we all know that everyone does better when housing needs are met. Yet too often, the issue fails to break through much of the noise. We focus on the other things. We focus on the day-to-days, but we don't focus on the fact that so many Nevada families are at need or at risk at all times. The COVID-19 pandemic hasn't created these problems, but it has exacerbated them. It's brought forth a number of challenges that families have to deal with every day as we're working to combat this virus and rebuild our economy together. So over the last 7 months, I'm sure we've all been asking ourselves some of the same questions. How do we prevent a mass wave of evictions for folks who have lost their jobs? How do we stop the housing market from crashing due to a wave of foreclosures and repeating the issues that we dealt with during the Great Recession? And how can we do everything in our power to keep people in their homes and give them the stability they need in order for our economy to recover? Now, many of those questions are the same sorts of questions that we were asking during the Great Recession. As the housing market collapsed, housing values plummeted, landlords were on the hook for months of lost income, thousands of families were left with nowhere to go. We knew going into this pandemic, we needed to act a little bit differently. We needed to address this problem more head-on and more immediately. At the beginning of the pandemic, the governor enacted a foreclosure and eviction moratorium, which expired on October 15th to be replaced by the CDC moratorium that Congresswoman Titus mentioned. And just from an aside, one of my best pieces of political advice is never go after Congresswoman Titus. So bear with me this morning. Our office worked with banks, we worked with credit unions, we worked with mortgage servicers to create protections for Nevada homeowners, including forbearance opportunities that were in place in Nevada before they were codified in the CARES Act and brought to the rest of the country. We wanted to make sure we avoided penalties and hits to credit, because credit hits actually just rolled off, as many of you know, for thousands of Nevada families that had to deal with foreclosures and evictions during the credit crisis. So we just cured that from a credit perspective, and we didn't want families to be at risk again, because those credit issues can stay with families, prevent them from obtaining the American dream going forward. We wanted to make sure to prevent that. And finally, we wanted to make sure that there were creative ways to pay forbearance back on the mortgage side at the end of that process. And that's been a really iterative process, right? Some families are going to be able to pay their mortgages, just append it as a separate loan to the mortgage, not going to have to do anything with it or pay it back until the house is sold. Some families are paying it off on a more accelerated pace. Other families are moving homes, downsizing, or getting into homes that make more sense for them now, given the strength of the housing market. But that all takes creativity, and more than that, it takes communication. And that's a lot of what I'm hopeful that we can get out of events like this Housing Summit, why they're so important. We've been able to utilize some of the coronavirus relief fund dollars to help with housing assistance, including more than $70 million in partnership with counties and cities across the state. Now, the state has set up foreclosure and eviction prevention portals through Home Means Nevada and Commissioner Chambers. We've also connected Nevadans with resources through the Housing Division at Business and Industry, as well as our partners at the Nevada Rural Housing Authority and the Reno Housing Authority, and of course, our friends in Clark County. We've also worked with the legislature and the Supreme Court to set up an eviction mediation process. And for those of you who don't know, Justice Hardesty is a tireless tireless advocate on these efforts. It is often that I start my day with a phone call from Justice Hardesty, which is, relatively surreal for a guy who was in the private sector less than 2 years ago. We've also got the CDC moratorium in place, and while that moratorium should be stopping evictions for non-payment of rent because it includes really significant penalties, including criminal penalties for non-compliance, we're finding that a lot of Nevada families don't know about it. A lot of Nevada judges are just finding out about it, and a lot of landlords either don't know about it or don't care about it. Those are different problems, and we can solve them differently. Now, as we try to get this aid out, we've run into some problems I'm sure you've heard about, and I expect we've dealt with in the past. Information not flowing to the families we need it. And this happens on the business side too, from an economic support. But sometimes we'll have a great idea and we'll be able to get that idea, package it up. But if the individuals who need it don't know about it, they don't know how to apply, or frankly, they're dealing with the pandemic and the other pieces of the pandemic that take up their time, we've got to get that information to them. We've got to make sure that they're able to actually do something with it. Making sure that the processes and systems, and for those of you who don't know, sometimes state government is a little bit archaic from a process standpoint. So trying to make sure that those processes work for Nevada families and are as simple as possible. Making sure we're reaching families where they live and in the communities and languages that they're most comfortable with. Dealing with confusing and overlapping programs, moratoriums, orders, and just a general level of confusion caused by the pandemic. And finally, an imbalance that we see in the marketplace between certain housing providers and housing clients. The information is not on an even foot, right? So I'm grateful to everyone on this call who works to make sure that Nevada homeowners and Nevada renters have the same information protection that Nevada landlords have. Now we're working through those issues, and it's dreadfully important, not just for the housing situation in Nevada, but for the economic situation. Housing instability is economic instability. With a tax base like ours that is discretionary as ours is, we need Nevadans to feel comfortable enough with where they're going to sleep that they're comfortable enough to spend money. The pandemic didn't create a housing issue in Nevada. It, like I said, exacerbated it. It's shown a brighter light on the work that we need to do and on the things we need to do better. Because some of these challenges, they're not new, they're systemic. Whether it's policies of exclusionary zoning that have left certain neighborhoods behind for decades, or the notion that we'd all love to build affordable housing, just not in my backyard. We have an opportunity to do better. We have an opportunity to change things. And that's going to take all of us working together to change the perception of what affordable housing is, to make sure that there isn't a concern about building affordable housing in our neighborhood, that we're not going to destroy the suburbs or whatever else the fearmongers might say. These challenges are going to be difficult, but they're not going to be impossible. We just have to do it. As leaders, we have a responsibility to make sure that every resident has a safe and affordable place to live. That's why we need to do better. We need to think bigger. We need to act boldly to work towards positive change. Now, since 2019, the State Board of Finance that I have the pleasure of sitting on has approved more than $500 million in bond cap for new and refurbished units across the state, with hundreds million more on the way. While this is a great progress, it's not enough. We can start by having local, county, and state governments work collaboratively to identify new opportunities to incentivize infill development. We're very happy in our next Board of Finance meeting. There's a developer who's never done affordable housing, who is joining the small group of dedicated affordable housing providers in creating a new project down here in North Las Vegas. We're very, very excited about that. But after that, we need to work to bring private industry to the table to invest in communities which desperately need more units. We can use the tools we have, like private activity bonds, and we can create new ones, like the State Infrastructure Bank that our office is working on along with the Nevada Department of Transportation and many other stakeholders, to leverage even more opportunities to get projects off the ground, incentivize further development, and put more families in single-family homes. We're all dealing with the immediate effects of COVID-19 and the effects that it's had on renters, on landlords, and on the economy. We need to ensure that rental assistance get out the door to the people who need them the most, and we need your help to do so. We need people to apply for the programs. We also need people to understand how the eviction mediation program works, how they can get access to it, how they can get access to funds, and how they can make sure that the CDC moratorium is used, right? And that landlords are aware of it. And as we think towards the future about what it's going to take to create a more sustainable housing environment going forward, we can think about that while we're thinking about the current problem, because if we can fix that long term, the next time we have a pandemic or recession or something else happens that we weren't prepared for, it won't be the weakest among us who are hurt the most. I want to thank all the regional housing authorities for working so hard every day to make sure that people have access to the much needed rental assistance that they need. Mr. Brewer, Mrs. Cooper, and so many others. It's been great to work with you and learn more about the process and the work that you do every day to help people. I'm confident that through continued collaboration, innovation, and a willingness to keep a roof over every head in Nevada, we can accomplish things that we know need to get done. From there, we can work to enshrine this truth that housing isn't something people have. Housing is a human right, a right that every person in our state has access to, a right that we need to make sure as a state we're providing for. And together, if we do that, we can create this brighter, bolder Nevada that I think we all want to live in, make it a little bit better for our kids, our grandkids, and for kids we're never going to get to meet. Again, thanks so much for having me today. I'm Zach Conine, and I have the pleasure of being your Nevada State Treasurer.
Elaina, I think you're on mute.
Thank you. I have 2 mute buttons. Thank you so much for those remarks, Treasurer Conine. I don't think you could have summed up not only our session today, but our goal for this entire summit better as we think about listening to Nevadans, understanding the Nevadan experience, and working together and collaborating to make sure that we do ensure that housing stability is an economic right and that it bolsters our economy. And so as I tee up our panelists and the session we're going to have this morning, I again wanted to think about one thing that the treasurer said that I think is important for all of us to focus on is that challenges, it did certainly exacerbate them. And so what the Nevada Housing Coalition has been doing since the pandemic is thinking about recovery, both short, mid, and long term, and what this pandemic and the challenges that it's presented, the opportunity that it has also presented for all of us to collaborate and work together to think about recovery, but also equitable recovery, and think about how do we fix things that have been broken even pre-pandemic. And so I think again, those comments were perfect, and it tees up perfectly our next discussion and our plenary session for today, because what we are going to talk about is that Nevada perspective and those and the voice of Nevadans and the voice of different sectors. So one of the things that the Nevada Housing Coalition has been doing in working on an equitable recovery strategy has been conducting focus groups with different sectors throughout the Nevada economy, including nonprofit, local government, health, education, developers, business sectors, and understanding the perspectives of those different sectors and what challenges they're facing, what sort of policies and funding they need to, again, be plugged into that equitable recovery strategy. And so while we've been conducting these focus groups, our goal for our session today is to bring this conversation to you and to include you in this conversation. And so we are going to hear from panelists that represent different sectors and different voices from those focus groups, and they're going to share thoughts from their personal perspectives, their organization's perspectives, and their sector's perspectives on 3 topics. One is the challenges that this pandemic has really uncovered and surfaced for them. The second is funding. What funding is needed and what would you do with it? And the third is policy. What policy changes are needed to, again, move us towards equitable recovery from the perspective of each organization and each sector. And so with that, I want to tee up our panelists because we're going to ask them questions and give them each about 3 minutes to answer those questions. And then we're going to open the conversation up to everyone this morning via polls and also via the chat to hear your voices. And on the back end, we're going to be capturing those comments and anything that you offer to plug into our recovery strategy that we will be publishing at the end of this summit. And so with that, I would like to introduce our panelists. And Charlotte, would you mind sharing the slides again? And I will give our panelists a couple minutes, just about a minute or so to introduce themselves. But I do want to call out Lisa Bogard, one of our panelists, who is also one of our presenting sponsors from Anthem, Blue Cross, and Blue Shield. So we're really pleased to have them represented, not only as a sponsor, but on our panelists as well. So we'll start with Tammy. Tammy, do you mind introducing yourself quickly?
Not at all. Good morning. It's an honor to be here. I'm Tammy Hanslair. I'm the Chief Executive Officer and State Director for Communities and Schools of Nevada. Communities and Schools works in mostly our Title I schools across the state. We place a full-time site coordinator in each of our schools to help with wraparound services, to keep our kids in school, and to graduate them on time. We are in 72 schools across the state, representing 4 school districts. We are in Washoe County, Elko County, Humboldt County, and here in Clark County. And I'm really looking forward to the discussion on how housing and education meet and how we can improve and work together. Thank you.
Thanks. Lisa, do you mind going next?
Good morning. So my name is Lisa Bogard, and I'm the president and CEO of Anthem Medicaid. And I have the privilege of leading this incredible team that supports over 236,000 members in Washoe and Clark County for the Medicaid population. This is an incredibly important topic. As the other speakers have mentioned already, we are focused on this and just incredibly pleased to be a part of this discussion today, and really look forward to just a collaborative session. Thank you so much.
Thanks, Lisa. And Fuilala, we'll have you go next.
Hi, I'm Fuilala Riley. I'm the president and CEO of Help Us Southern Nevada. We celebrate 50 years of service in our community this year. Yay, COVID. We also, tens of thousands of Southern Nevadans access our services annually. But this morning, 700 individuals woke up in a Help Us Southern Nevada program bed. And those program beds range from emergency shelter, bridge housing, transitional living, as well as permanent supportive housing. And we're just really happy and honored to be included on this panel. So thank you.
Thanks. And we'll have Kristin go next.
Good morning. I'm Kristin Cooper. I'm an assistant director at Clark County Social Service in Las Vegas, Nevada. And I'm delighted to be here. Thank you for asking me. I have a background in affordable housing, and now as the assistant director at Social Service, our mission is to help those who are indigent in our community. And we do that through a variety of means. But a lot of it is, it stems from both unsheltered street homeless all the way up through the development of permanent affordable housing and hopefully eventually to home ownership. We haven't focused our resources on the home ownership piece because we have such a huge need in our community at the lower income levels. So that's our mission, that's our focus, and I'm delighted to be here. Thank you.
Thanks, Kristin. And next we have Bill Brewer.
Good morning, Bill Brewer here. Appreciate this opportunity to be with the summit this morning. I've spent most of my career actually, in rural Nevada, working on affordable housing issues. And they are not that much different from those issues that are faced in urban areas, but size and scale does make a big difference. And that creates some additional challenges for us, which are always fun to try to meet. So look forward to the discussion today and hopefully getting some good ideas to help us move affordable housing forward.
Thanks, Bill. And then last but certainly not least, we have Mike.
Mike Kasmersky with Edon, Economic Development Authority of Western Nevada. We're up here in the Reno-Sparks area, and our focus is quality job creation. If you have a quality job, you have housing security. So many of I see the providers and members of the forum today are in the give a person a fish mode. You've got someone desperate, you're trying to help them survive. We're very much in the teaching of the fish mode. If we can bring in great jobs and help people get a job that pays a living wage, they're not going to have housing problems. So we bring in that different perspective. Elaina, you're frozen. Oh, there you go.
Matt for this discussion is going to be, oh, can you hear me okay?
Yep.
Good. So thank you all, and we're delighted to have such a superstar panel today representing such important and such diverse sectors of our Nevada economy. And like I said, the format today, we're going to ask a question and give everyone about 3 minutes to answer, and we'll go in the order that everyone introduced themselves. And then, like I said, at the end of each question, we will open it up to the audience to share their perspectives either via chat or via poll. So the first question that we're going to pose and ask each of you to answer is what are the most significant housing related challenges that you, your organization, or the people you serve are facing as a result of COVID-19?
Right. Thanks, Elaina. So our most significant housing related challenge in the education sector, specifically with the students that we're working with, actually, as the treasurer mentioned, was a problem before COVID-19, and that's just exacerbated it. And that is our school transiency. So the average school transiency rate in Clark County is about 24%. So that means 24% of the students that start the school on day one, 24% will not be in that same school by the end of the year. That's a pretty high number. That's the average rate. As of May 19, 2019, and I'm using stats from a Gwynn Center article and study that was done in May of 2019, that we had, in Clark County, we had almost 30 schools that had a transient rate between 40 and 60%. Again, 40 to 60% of the children that start that school in that year will not end that school in that year. And that means that these children, when they're taken out of school, they don't just go take out of school on a Monday and get re-enrolled on a Tuesday. They're usually out for several weeks. And that puts them behind. That puts them behind in math, that puts them behind in English, that puts them behind in the social emotional piece of the puzzle. And that was before COVID. That was when you were in school live as a new student walking into a new building. So you can imagine now, as we are now, really dealing with what's going to be a major housing challenge and situation as families are doing that. And the question then becomes is why is transiency so high? And it is a lot because of the affordable housing that the treasurer mentioned. There is just lack of it. A lot of families are leaving to try to get better housing, or they can't pay their rent, so they're trying to move somewhere else to try to keep up and just try to keep up with the pace. And in that May 2019 article that was written by the Gwynn Center, they did a really interesting conversation about the relation between transiency and evictions. And in just some of their initial studies, we'll use Loman Elementary. Loman Elementary is actually a CIS school as well. Loman Elementary in 2019, their transient rate was 57%. That's over half of the kids that started in that school did not end in that school. And their eviction rate was 16%, which is a really, really high number of in that area. So these are the conversations that relate to CIS. These are what we're trying to do as a wraparound service provider and as a social emotional support mentorship group. We'll start working with a student and start finding out what situation's happening, what trauma is happening. But then if they turn around and move, all the work that we've done is then has to be restarted, just like on the education side, just on the social emotional side. And so for our kids, that can be really traumatic if they're moving 2 or 3 times in a school year, if they're having to make new friends. And especially now in a COVID environment, we're in a digital learning environment. And, you know, that's frustrating enough. And then making sure that they have connectivity and they have internet and they have all of those accesses. So for us, that is what we were dealing with prior to COVID. And that has certainly been exacerbated since the pandemic. And, you know, we are grateful for the governor for the moratorium on evictions, because that could at least keep our families safe. Now we're frantically trying to make sure that they have the information for the CDC guidelines so that they can stay in their homes. But we know that that is just a little bit of a Band-Aid until that isn't allowable anymore, and they will have to make some moves. So for us, that's the biggest thing at this point.
Thanks, Tammy. Lisa, do you want to share the challenges that you've seen?
Sure. So first, I would just, from the healthcare perspective, just like to say that, you know, it has been challenging and an unprecedented time for all. It goes without saying that Anthem really exists to improve lives, both healthcare and our communities. So we do this in a number of ways. We focus on health and health outcomes because, as we've learned in this 2-day session, that health outcomes really do depend on socioeconomic factors, and housing is one of those important. You know, access to housing is critical. So when we see health decline, it can also impact housing stability. And on the flip side of that, when housing stability declines, whether that's due to a loss of employment, your income availability, it can also impact both physical and mental health. And so we have certainly seen an increase in the need for mental health services during this COVID pandemic. In order to succeed, though, in our mission at Anthem, so we're not only focused on helping communities access healthcare, but we also are addressing the social determinants that impact health. And that includes access to housing and housing stability. We do this by adding benefits, adding housing, and building housing related benefits that support programs and services that we currently offer that are outside of the core benefits that the state covers in the Medicaid plan today. So I'd like to share with you just a few of those examples. We have a family diversion program. We have assisted based on the governor's request to increase COVID testing. So we've had COVID testing events, flex funds, healthy living expansion programs. And so I'll focus on just a couple of those because I know I only have 3 minutes. The family diversion program is Anthem funded Clark County social services for a new and innovative housing program that actually prevents homelessness for families. We know that in times of crisis, families are often separated. And so this program really helps to identify immediate alternative housing assistance. We do this by whether it's paying rent, utilities, or even mediation with a landlord. The Clark County services are able to provide that support to families in Nevada. And that program has been in existence for several months now. And we're really excited about the opportunity to continue to fund this effort. You know, it not only helps those in immediate need, but it also reduces the number of families that become homeless, the demand for shelter beds in our community, as well as wait lists for other programs. If we can keep members in their homes and not have to make the hard decision between feeding their family and paying their rent, this is one of those programs that is able to assist in Clark County. The second program is a grant that we provided to the Carson City Health and Human Services, and it's a flex fund. And so with a flex fund, that's really what it entails. It's a flexible ability to be able to help with housing needs in a specific area, in this case, the greater Carson City community. And so landlords, I think, are incredibly important to this discussion and part of the solution for affordable housing solutions. And Anthem, we want to be able to help and partner with our landlords in the community. You know, we all know in a tight housing market that there really isn't a lot of incentive to be able to have landlords lease to individuals that may not have the best credit. They may have evictions in their history, and there might be a little bit of apprehension about if they're going to be able to make the rent every month. So these flex funds are used to incentivize and support the landlords in our housing community, which ultimately expands the availability of affordable housing in our community. And then I'll touch quickly on the Healthy Living Program. This is one that is a partnership, including Clark County Department of Social Services, Anthem, as well as the other MCOs in the state, HELP, the community-based organization, and the Clark County Continuum of Care. And this really is, I think, a best practice in regards to all of the support that is needed. We're increasing the amount of available housing by providing the grant through the HUD grant, and being able to support these members and these members of our community that are high vulnerable, medically frail, and they don't have to be chronically homeless. So this really is opening up a new population to be able to be served in our community. And so Anthem has, out of the 90 individual we've supported 30, and that program just began in October. So we're really looking forward to that program. I would also say that since March, Anthem Blue Cross and Blue Shield has invested more than $4 million locally in housing and housing support here in Nevada. The need for housing continues, and we're helping to provide those services and supports. We're all in this together. There isn't one single solution to this housing crisis, but we recognize that we want to be part of that solution, and we're committing more time and resources to addressing not only the health side of it with the physical and mental health needs that are raised by this pandemic, but also the housing needs that have been escalated by the pandemic. So it means pushing greater investments, but also pushing our social workers, our outreach. Education is key, being that advocate and engagement with others really to address the increasing needs related to housing. Thank you.
Thank you so much, Lisa. And Fuilala, would you mind sharing some of the challenges you're seeing from the perspective of HELP in the nonprofit sector?
Yeah, so housing related challenges prior to COVID: availability, affordability, background checks of those that we're trying to assist, and rental history of folks have always been a challenge. Still a challenge in COVID. Some of the things we've seen, though, due to the pandemic, are the availability of appropriate housing to meet the type of clients that we're seeing. We have seen some pretty large families that were living in their vehicle, and finding them appropriate housing, even in an emergency situation, you're putting them in probably 2 hotel suite type situations until we can find a more long-term situation for them. The first-time homeless are a challenge for us just because of their lack of knowledge of how to navigate the systems of services, and their unpreparedness to have documents that many of our programs require for eligibility. And then more interesting to me has always been folks continuing to think that Southern Nevada streets are paved with gold. So they are relocating from other states, even in a pandemic, What we've seen also is people that perhaps have a housing voucher from another state trying to transfer in, and those units aren't available. And so those folks are limited to a time frame, or they lose their voucher from the other state. So it's kind of the working up against the time frame of, you have a voucher, let us help you. But it, you know, finding those units that those folks are available for are something that we have seen quite a bit of. And then, of course, our hidden homeless, we're very adept and experienced at working with homeless. But when the pandemic shut down our town, one of the things that shut down was all our 24-hour establishments that have 24-hour parking lots where people could hide in plain sight if they were living in their vehicles. That's when, you know, when we shut down, security was now noticing people and asking them to leave. I would say for the first several weeks of the shutdown, every morning our street team would come into the office in the morning, and there'd be several vehicles of people that were directed to come to us for services. So that's something that we've seen, and just the increase of people. And then the types of housing that is needed is really something that we need more of. And I'm hoping we can get some really great ideas and that we can move on. Thanks.
Thank you for sharing that. And Kristin, do you mind sharing what you're seeing from a local government perspective?
Sure. So I would say that I agree with everybody, with Lisa and Fuilala and Tammy. Essentially what this pandemic has done is it's laid bare the discrepancies and the inequalities that were already in place, and it's just made it's trebled it. So we've always had evictions. We've always had people on the street homeless. We've always had people in shelters. What this has done, though, is had several add-on effects because of it's a disease. So the shelters have had to reduce their capacity because they need to engage in social distancing within the shelter. They've shut down certain services. We had no day shelters this summer, so people couldn't come in from out of the heat. And so, and those have health impacts for people. And it's a real problem that we're worried about actually going forward, because, you know, who knows when we'll get a vaccine? Who knows when this will sort of peter out a little bit? It may be several years. And so we're trying to plan for that at the same time as we're still trying to deliver our regular services. So it's been very challenging for social service, and the staff has really stepped up and have done an amazing job. But we know that our funding, one of the issues that we see coming up is our funding. We have coronavirus relief funds that are going to be going away at the end of December. And it's a significant amount of money that will end up having, hopefully we can spend it, but it's been difficult because we only have so much in terms of community capacity. So one of the other things that's become clear is, we have agencies like Help Us Southern Nevada and like CIS that are stepping up and getting out there and trying to do things in the community. But we have a limited capacity at our nonprofit level, and so we need to be providing those nonprofits with the resources that they need, whatever that is, to make sure that they can hire and continue to do the job and expand their services at a time when funding is an issue, and a lot of people aren't able to donate like they normally would. I would say that evictions right now is the thing that I'm focused on and that our team at Social Services focused on. We're providing a CARES housing assistance program through both Clark County Social Service and 14 nonprofits in the community. And they've managed to assist about 4,000 people to date, but we know we have a waiting list right now of probably about another 5,000 within the community that we're trying to process and get funds out to pay their rent, pay their utilities, pay their mortgage, so that they are not ending up being evicted. And we also know that evictions are happening anyway because the CDC doesn't protect against evictions for certain causes. And so we are seeing an uptick of evictions coming into the courts. And we know that after December 30th, when the CHAP program ends, when all these other programs end, that we're going to fall off a cliff and it will be a tsunami. And so those are our biggest concerns right now. On the far side of that, affordable housing is the thing that we're missing, and it was missing before the pandemic, and it's clearly missing still. We need to be able to move folks from, we've provided non-congregate shelter during this crisis. That was one of the things that we stood up. That means hotel motels, where we can send people who are coming in off of the street, who are unsheltered homeless, who are high risk for poor outcomes, in other words, very sick or dead from the pandemic. I always think poor outcomes sounds so generic. In other words, people are going to die unless we can get them off the street. And these are people who are 65 years and older who are homeless. And we have a significant number of those folks in the community, about 2,000 of the people that are out there that are street homeless. They have high vulnerability. So either older or they have underlying conditions. And those underlying conditions, are the ones that make you vulnerable for COVID. So heart issues, stomach issues, diabetes, that kind of thing. So we were able to get some of those folks into housing, about 300 at this point. We only have room for a few more. In fact, if anybody's out there and you have a hotel that you know of that would be willing to take homeless people, let me know, because I need to find another location for another non-congregate shelter. So all suggestions are welcome. And then we need to rehouse those folks on the backside into more permanent housing. And so that's the other push that we have going forward, is we're going to be doing a very large community rapid rehousing program using CARES funding, but it's Community Development Block Grant and Emergency Solutions Grant from HUD to move those folks through that system. So a lot of challenges facing the community. We've got things in place through, the emergency, the non-congregate shelter, the rapid rehousing, the CHAP program, the CARES housing assistance program, which is the rent and mortgage assistance. We've done all these great things, but what we need the funds to keep that in place, because those things are actually helping people. We're actually keeping people safe. We're getting people off the street. We need to keep them off the street. What we don't want to have happen is at the end of December, that they end up going back to the street. We're fortunate in that we have really excellent leadership at Clark County, and our board and our executive management all understand that that's an important need. And so we'll be moving forward to the board and hopefully, and I'm sure they'll support this, provide county funds in place of those coronavirus relief funds to continue to house those folks until we can move them into permanent housing. I know it was a lot, sorry.
Thanks, Kristin. Bill, do you mind going next and sharing what you're seeing from your perspective?
Sure thing. Elaina, thank you very much. As Kristin mentioned, one of the things that we're dealing with in rural Nevada is the threat of eviction and foreclosure, those kinds of things. So we're trying to keep folks in their homes. We are administering the CHAT program for rural Nevada. We've funded about 454 applications so far, over $1 million. That doesn't sound like a lot to the urban folks, but that's a big chunk of change in rural Nevada to keep folks in there. And as Kristin pointed out, one of the major challenges we have is this thing evaporates at the end of December, and we're not going to be able to help folks beyond that. And that's, of course, when the moratorium is lifted, and we're going to see a lot more activity. And so the challenge is having funding available to help folks as they need it. We're doing our best to get the word out to everybody. It's one of the other challenges we have in rural Nevada is getting the word out to such a broadly spread population, thinly spread population without a lot of connectivity. We struggle with that. In fact, that's one of the major issues we see with our people who are inhabiting our units and other rent supported units is the lack of connectivity. Broadband in rural Nevada is not the same as it is in urban areas. We take it for granted, around here. If you want to get online, just go get online. And out there, it's not always that simple. And so children who are being homeschooled and where schools are not able to accommodate folks, that becomes a much bigger challenge in these rural areas for us. And so it's a little like the old REA was 100 years ago to get electricity to rural areas. Now we need the same kind of effort to get broadband to these rural areas, not only for social support, but economic development as well. So those are our big issues. Certainly one size doesn't fit all. The rurals haven't been hit as hard with the pandemic as the urban areas, but we still have those challenges to deal with. Thanks, Elaina.
Thanks. Thank you, Bill. And Mike, we'd love to hear from you about what you're seeing at an economic development from an economic development perspective.
Well, first off, I just want to say I'm impressed with all the things that are going on. I think most people realize this is a crisis that is probably not going to go away anytime soon. But I feel a sense of frustration across the board that why are we doing evictions? Just leave them in the hotels and that'll make everything better, or the houses or the apartments. And we don't realize from a business perspective, and again, we're looking at economic development. So we see the business side, those owners, those landlords are paying their rent as well. And no one's giving them moratoriums on paying their rent. Banks will foreclose on them. They have employees that will be out of jobs, and eventually that facility will close. So while a short moratorium totally makes sense, when you start looking beyond, we keep saying, well, this is gonna, end of the year and moratoriums are lifted, and maybe we just extend the moratoriums. All you're gonna do is roll a whole lot of owners, landlords, and their employees, put them out on the street, and the government is basically, instead of subsidizing rent, taking rent away from those owners. So there is, there's always a second side to this. On the economic development front, again, I mentioned initially, the solution to the housing problem is a quality job. So what are we doing on the, it's not an either or. We've got a crisis now where we got to address the real needs of people now, but this pandemic's not going away. And how much longer can we continue to do the feeding a fish mentality when there are great jobs coming to our state? Up here in the north, it's very different than the south. We're actually at an unemployment rate below the national average. We've got people, remote workforce moving here, which is killing us. Kind of, you would think that would be good news, but bad news, because it's killing us on the housing side, because they come here and buy the houses and put demand on housing now. Our availability of housing is 70% less than it was last year. So when they come in and they see a $500,000 house, which is a stretch for most of our families, they just drop cash on the table and move on. We cannot afford our housing anymore. We went from $188,000 median home price to $460,000, and it's only going up from here, which means now you have to go rent. Well, of course, we haven't been building enough housing. The pandemic has adversely affected the additional housing units in our area. So our new housing permits are at half the rate they were last year, which just means next year is going to be much worse. So the supply and demand equation is a very real issue for us up here, and it's going to get much worse. I think on the, as we talk about funding, there's got to be a way to address the potential for, instead of, taking, putting people out on the street, how do we subsidize people where they are now and get them a job so that they can pay part of that rent, if not all of the rent. So again, on the economic development side, job attraction, even though the state has focused on, the crisis at hand, is not a earthquake that's gone next week. It is a long-term crisis. We need to be addressing the job creation piece at the same time we're trying to help people in the crisis mode. So that's really, from our view, the housing related impacts of COVID it's just exacerbated our shortage and made it even more difficult. Fortunately for us here in the north, our job creation efforts have allowed us to weather the storm better, although the demand for housing goes up while the supply goes down.
Thank you, Mike. And thank you. I think what our panelists have done is really help level set where we are right now and what we've seen in the short term of this crisis. And I think the next couple of questions and topics that we'll talk about will help us think about recovery, about midterm, about long term, and what we do going forward and what we look at. So the next question that I would like to pose to our panelists, or you know what, I'm sorry, before we move on, we will be doing a poll to get feedback from all of you who are joining today. So I know Charlotte has pulled that up, and we're going to be using Slido to do that. So you can either scan the QR code with your phone or join at slido.com.
And I'll give everyone about 30 seconds to get into that and to access it. So you can go into slido.com through your browser with your phone or your computer and type in the code #NHCP2. And you can see the little counter up in the corner, letting us know how many people have participated in the poll so far. And as the question reads, we're just looking for 1 or 2 words. Got about 35 responses so far. Give you about 10 more seconds.
And if you're really struggling to condense it to 1 or 2 words, please feel free to put a longer answer into the chat and we will capture that as well.
We have almost 45 responses. So I'll give you a countdown of 5 seconds and then we'll close the poll. We'll close it in 5, 4, 3, 2, 1.
Well, I couldn't think of a better topic rising to the top here than funding, because the next question that we are going to ask our panelists is, if you had unlimited funding, how would you use it to address our housing challenges for an equitable recovery? And once again, we will start with Tammy.
Wow, you're asking a nonprofit if they had unlimited funding. I mean, I don't even know. We don't have enough time to even be able to answer that question for sure. But you know, the one thing that I've said about communities and schools, we are the most effective dropout prevention organization in the country. So we're actually a national organization. We're in 26 states, and nationally we represent 1.6 million students. And wraparound services mean we address whatever barrier it is that's keeping those kids from coming to school and being successful. And we actually are in K through 12. So, because we know students just don't wake up their junior year and to just decide to drop out of high school, right? It's been a slow process through their elementary and their middle school, and now in their high school, the barriers sometimes are just too high. So if I had unlimited funding, I would put communities and schools in every school, wraparound service provider in every school in the state of Nevada, and not just Title I schools. We know our Title I schools are the highest need, but students across the board from every economic status need wraparound services. They need a caring adult. They need that extra person in the school that can help them overcome whatever barrier it is. And that will in turn help our teachers and help our admin, because they won't have to deal with some of those challenges. They can focus on educating and really educating our students, and the wraparound service provider can focus on the social emotional and the wraparound services to keep our kids in school and keep them motivated and graduate them, which will of course benefit our economic stability, because the graduation rate is higher. Is always going to make our economic as a state, you know, a much more successful stability organization. So that's my 3-minute answer.
Thank you, Tammy. And you did a good job keeping that at like 1 minute. So extra applause for you. And okay, so Lisa, we'd love to hear from you from a health perspective.
Absolutely. And I agree with Tammy. Wow, it would be incredible to have unlimited funds for this. And so if I was thinking on that lens, I think it would be great to fund development of both supportive and affordable housing with an array of really cultural specific housing and medical services. We could work really to assure that that housing is in all neighborhoods. And of course, it's important to, you know, provide, really collaborate, I would say, and partner with all communities in the developmental process to assure that we're building, you know, the right houses, the right way, in the right locations. You know, the reality is, of course, we don't have unlimited funds. And so as a managed care organization, we certainly appreciate that we want to be part of that solution. For those of you who are not aware, we receive payments based on an established state reimbursable benefits. So what the state covers, we receive a monthly payment in order to provide services, medical services for our members. And so we understand firsthand the benefit of housing in regards to a person's improving their health outcomes, and as well as the cost to the system overall. So I just wanted to give you an example of a recent member who actually was homeless, and he quite honestly had just lost his will to live. This gentleman attempted suicide multiple times, which landed him in a medical facility, an extended stay, and in 6 months he had been admitted at least 10 times. So aside from those underlying behavioral health issues, this member also struggled with opioid dependency, alcohol and marijuana issues. And he had he really was struggling with chronic homelessness and had absolutely no support from family or friends. And so this is where Anthem really is able to provide support in addressing the member's social needs. So we talked about those social determinants of health. And that included not only the medical, the behavioral health, but also transportation and education. Once we were able to identify those needs, the case managers were able to work with this member on all of those things, including housing. And so Anthem was able to secure housing in a healthy living group home. This member is currently receiving in-house support and treatment, and he's doing extremely well. And I know this is one member, but there are so many members that we're able to impact and help. But it takes education, it takes job opportunity. It's really looking at that whole person care, because all of it is important in order to move the needle and make sure that we're able to address all of the social determinants of health that each member faces. So I'm really encouraged that this member has been sober since August. They are getting ready to move into their own apartment, and they've reconnected with their loved ones, and they're going to provide some additional support. So housing in of itself, the ability to house someone can really offset the cost of healthcare overall and other costs in the state, instead of the not addressing those needs. But it really begins with housing and stability and being able to address those needs in a place that a person has dignity and respect. So thank you so much.
Thanks, Lisa. Kristin, we'll turn to you again.
Okay. So essentially, if I had all the money that I needed, I would focus in two areas. One is people who can work. So I would focus on workforce development, because I agree with Mike that it's better to have somebody be able to go out and work. It provides a lot of things that you wouldn't necessarily think of, like dignity. And a lot of people want to work. It's just that they don't want to work for $9 an hour and then try to afford an apartment that requires them to be making $18 to $20 an hour. And that's, even with a roommate, it's a struggle. So I would say that workforce development is where I would put a lot of my money. And I would also focus not just on those who are homeless or near homeless, but also those who are really in jobs that keep them unstable, keeps them that they have real problems with housing instability. So that's one thing. I would also focus my efforts on people who are disabled or who are unable to work for the long term. I think we do a terrible job of caring for our most vulnerable community members. And so I would work on providing housing that comes with housing supports. So in addition to, obviously, I would build more affordable housing, particularly for people at 30% of area median income and below. And then I would make sure that either the rents were low enough that they could afford them on their limited income, or provide rent supports for people to live wherever they want to in the community, so that they can live where they need to live. I would also make sure, Lisa, I think, has a great point, which is that they need medical supports as well. And we need to put in place medical assistance for people who don't qualify for Medicaid, because there are those folks who simply don't and don't have access any other way to healthcare. And then education. I think that's really important. You can do all you want, but unless you provide education opportunities to children, so that would mean supports like Wi-Fi, free Wi-Fi or hotspots, tech that can help those kids to have a foot up instead of not having that. And then childcare. I think, again, we don't do a very good job with childcare. Childcare is a very big expense for a lot of people. And so I would look at making sure that there's childcare assistance much more expanded than what we currently have available in the community. And then I would also say that one of the things that we can do where that impacts funding is to expand new partnerships. So I wanted to just let you know that we have a partnership now with Anthem. They've graciously brought to the table to the continuum of care, and it's coming through Clark County Social Service, but it's going into our rapid rehousing project. They're providing funding for us to have a computer program that allows us to get as many landlords and their units into a particular system, and then all of our case managers have access to that system to then be able to place people into housing. Now, the challenge, of course, has been getting those apartments. They're providing the funding for a housing navigator, someone who can do the outreach to the community so that we can go out and interface with landlords and try to bring them in to the system to provide us with affordable rental apartments that would be subsidized through a variety of means. In this case, it would be through the Emergency Solutions Grant Program. So we're really excited about that. And I think that those kinds of partnerships are really important going forward. And then getting as many street homeless into housing as possible. I agree again with everybody who's commented so far, because that will have an impact on the costs that we spend on police, courts, hospital, that our nonprofits have to go out and raise monies for. So that is what I would do if I had all the money.
Thank you, Kristin. And Fuilala, sorry I went out of order, but we will go to you next to share your answer from a nonprofit perspective.
So I actually, from a collaborating nonprofit, one, I would make sure that a number of my nonprofit partners that help us get our mission accomplished and had the funding as well. We like to share. So like absolutely our 3 Square partner, I would make sure that they had all the resources they needed because they help feed our entire community. Thank you for letting Kristin go first before me, because a number of what she mentioned was something that I love hearing that. And as one of your subcontracting nonprofits, I would assume that all your funding meant that I would continue to be able to provide some of those services. But yes, of course, build more housing. We also have programming in Workforce Connections, WIOA programming. We need more of the workforce development. I heard yesterday that our rents were increasing or had increased by almost 5%. And we all know that the workforce here in Southern Nevada, most of them average a 3% increase annually. So obviously there's a divide with that. So we absolutely need, I would try to work out some way to have a living wage. But it's important that we have all sorts of housing being developed because we have different sizes of the homeless and low income that need the housing. So we have family units and then we also have single individuals. There's quite a number of single individuals that are homeless and are in need of programs like Healthy Living, where we are going to partner with the MCO, partner with Clark County, and then we provide the case management. So of course I would increase case management and navigation services. But additionally, I'd really like to address the digital divide for a lot of our families and individuals. Great thing that happened over the pandemic was telemed was allowed, right? And so all of our clients that have a therapist and are in therapy, they were able to reach out to their therapist through the phone, but many of them don't have internet or a computer at their place. And a lot of them have anxiety issues and just the whole, it was scary for all of us. But if you're in a tenuous place with your mental health, it was like very, very difficult to keep them in therapy, keep them connected to where we could keep track of them. And so I would love to be able to provide internet and some way for all of our clients in housing to be able to speak to their therapist through video chat. Because those that had that, they were more successful in maintaining their therapy. The phone just isn't the same. It's better than nothing, but it wasn't the best for our clients. I'd also create a pot of money for rehabbing existing homes of folks that are under a certain income level, and particular senior citizens. We see a lot of that through our weatherization program, but it's very, sometimes we have to do a deferral and walk away and not provide the service because maybe there's damage to the home that is water related, and our funding doesn't cover that. I would definitely want to make sure that we had a pot of money for people that needed repairs to their home so that they could stay in their home longer. And then, of course, I'd also want to provide incentivizing landlords, because the more people that could come into, maybe it's the more the rental deposits. It's that money that we could provide for those funding sources that may not have damages already built into their funding source. So tons and tons of, and then of course, more rental subsidies for those that just need a little bit of help, maybe don't make that 2.5 times their rent, maybe, just more of those for folks that are that close to being able to get to that 2.5 times. So thank you.
Perfect. Thank you, Fuilala. Bill, we'll have you go next. And we're getting, and sorry to, I don't want to discount anything you have to say, but we're getting a little short on time. So Bill and Mike, I might ask you to keep your answers to 1 to 2 minutes if you can.
Thanks so much. No offense taken for sure. I know time is limited. So I'll just mention, if I had all the money in the world to address our problems, I would probably really look at some deep subsidy for our folks who are at extremely low income. You know, 2/3 of our clients who are receiving vouchers are seniors or disabled. They're not able to work. They're not part of the workforce. And a significant part of our population out there is just not able to get a job and pay rent. And so they're going to need some deeper subsidy. I would also use some of that unlimited funding to create some additional units. We were already in a crisis before COVID hit because of our lack of affordable housing. So we need to build some and get some more units out there. And recovery was going to take some time, but excited to see what we can do about it. Thanks, Elaina.
Thank you, Bill. And Mike, we will close this topic with you.
Well, wouldn't we all love to have a nice bucket of cash, right? Especially nowadays. Kristin really hit it on the head, in my view. Investing in education is more about teaching people to fish. There are people that cannot work, need help. We know that. Social Security, Medicaid, Medicare. We've got a lot of programs to deal with our seniors. We don't have a lot of programs to deal with someone who has 2 kids who just lost their job because the casino laid off 1,000 people and has nothing to do. And, you know, we go to the programs, but it's not going to help the kids. And in the long run, those kids are not going to have great job opportunities without education. In the short run, I think buying some of the hotels, because the visitor industry is not doing well. Those hotels in the Vegas area especially are probably fairly affordable and could be purchased and really help on the housing side. There are so many hotel spaces off the strip that I would think would be reasonably affordable. That would provide some temporary solutions there. But education, and not just education, but education, coding, robotics, the skills of the next generation, because the jobs coming here that pay living wages require skills. They don't require, you know, what we necessarily are providing now. They more technical skills, the advanced manufacturing jobs, the data center jobs. So workforce development is part of that now. How do we take someone who had a gaming or casino or visitor industry job and elevate them to the point where they have the skills to do an advanced manufacturing job that takes them from 9, 10, 11, 12 bucks an hour to $30, $40, $50 an hour, which is the kind of jobs we're looking at in advanced manufacturing once your skills are where they need to be. And then really investing in mental health and addiction, that addresses a lot of the challenges with the homeless. We've got to get them out of a track of homelessness, get the youth early, because if you can rescue a youth that's homeless before age 25, you can really change their life. After that, it's much more difficult. And then more housing. I mean, it's not just in the rurals, it's everywhere. We need more housing, subsidized housing. We're taxing the hell out of new development. We're making it harder and harder to make affordable housing, get it on the streets so that we have a chance to relieve some of the supply problem as demand continues to go up. And at the end of the day, economic development is about great jobs. As I said before, you don't have housing security issues if you have job security, and really education drives you in that direction. So that's an education, economic development view. Thanks.
Thank you, Mike. And so we'll open the poll up to the audience just to share quickly, either again, put it in the chat or feel free to answer the poll to share with us what some of your priorities would be to address equitable housing recovery if funding was not an issue. And again, we'll keep this one open for about 30 seconds or so we can then move on to the last question.
So with your smartphone, you can take a picture of the QR code, or you can open up your browser in slido.com and enter in the code of hashtag NHCP2. We have about 25 responses so far. So if you could just add in 1 or 2 words to answer this question of what you would do if you had unlimited funding. And we'll give you about 10 more seconds. All right. Build and education are the main ones. Thank you for participating in that poll.
Thanks, Charlotte. And then we're going to move on to our last question. And as we've had such a good discussion, we're short on time. So I'm going to ask our panelists a very challenging thing. If you can keep your answer to about 1 minute so we can get through and let Christine do a quick recap, that would be wonderful. So I know it's a big question and a very short amount of time, but what state level policy changes are needed to address our housing challenges in recovery? So maybe what would be the top priority from a policy perspective?
So I thought long and hard about this, but I think the one for us that would probably help us in the shortest terms is working on our state eviction policies and the no fault evictions that are able to happen right now. So I would like to see further work and clarification and improvement on that.
Thank you. Lisa, we'll go to you.
Okay, thank you. So I know that Fuilala mentioned telehealth. From a healthcare perspective, we've seen a 400% increase of telehealth since March. Getting access to care in these times where people are either not able to get into the doctor or afraid to go into the doctor is really important to making sure that we are maintaining not only just preventative care, but addressing more chronic diseases. And so we certainly, Anthem supports the continuation of expanded healthcare services. Additionally, there are populations that in the state program with members that are not currently carved into managed care. And we really believe that they would benefit from the housing support as well as additional case management and other benefits that Anthem provides. And then lastly, I would just say, we really do believe that the core of healthcare is the relationship between our members and their doctors. But to truly make a difference in our members, friends, and neighbors who live in our underserved communities, we really need to work within our communities and address these issues to make a positive impact on our community. Anthem addresses social determinants of health in a variety of ways. And I know today we've talked a lot about education. We provided 2 towers, supported the implementation of 2 towers in a historic West Side community so that children could access education during this time at home. It's incredibly important. We also support workforce employment in housing, transportation, domestic violence, maternal care, daycare, and so much more. So I've enjoyed this discussion today, and I really thank you for this opportunity and this collaboration. Thank you.
Thanks, Lisa. And we'll go to Fuilala.
Yeah, so hopefully we get to keep telehealth beyond this. It's permanently, I hope. And then the perhaps allowing local governments the ability to raise funds through either their taxing or fees or whatever to fund some of their local initiatives.
Okay, I know it's my turn, Elaina.
Thanks, Kristin.
No problem. So I have two. One is to expand the state affordable housing tax credits that were created at the last legislative session and expand those beyond where they currently are, and hopefully we can get those out. And then also have an expansion of the property tax exemption that currently exists for affordable housing. It currently only can go with the home program, and it needs to be expanded beyond the home program to all the other programs that that are available for the development of, and preservation of affordable housing.
Thanks, Kristin. Bill, we'll have you up next.
Amen to all that Kristin said, for sure. I totally support that. One other piece of legislation that would help is to free up local governments to be able to participate more freely in the encouragement and development of affordable housing. Local governments' hands are tied in many ways, and so some legislation to that effect would be very helpful.
Thanks, Bill. And Mike, we'll close with you.
Okay, well, I think a lot of great suggestions were already made. My view is it's all about supply. We need more housing. We need it now. But it also takes funding, and the state tax structure is broken. We've known that for decades. We need to fix it. Reset upon sale is one way to do that. Start to get some revenue off some of the houses that are $1 million that are not paying taxes at a reasonable rate. And then look at other ways to balance out our state revenue, because we're not investing in education, we're not investing in job creation, and we're reacting to crisis like this, totally underfunded, and our citizens are suffering.
Thank you, Mike. And then we'll, similar to the last two questions, I'll have Charlotte pull up the poll, and we'll do that quickly before we close.
So again, answering the same question with 1 or 2 words. When the poll's open, you can use the QR code or go to slido.com and enter in your code.
Our speakers hit on a lot of great policy opportunities. Thanks, everybody.
We'll give you about 20 more seconds to get in that poll.
Feel free to pop it in the chat if you're not comfortable with the Slido, but I can see the results coming in on the back end. Thanks, everyone. And I know we're running a couple minutes over. I am going to wrap up very quickly because the panelists were incredible at hitting all the topics, and I am so thankful. Thank you all for sharing with this group what we've been hearing. Both Elaina and I have been participating. This is Christine Hess, the director for the Housing Coalition, have been participating in these focus groups, and it's really amazing the work you're doing and the perspectives you bring.
So I'll close the poll in 5, 4, 3, 2, 1.
Oh, wow. There we go. So we've got some work to do here in Nevada, but thank you. Elaina, are you ready for me to just close us out?
Yes, please. Thank you, Christine.
Sure. So we wanted you all on this, in this audience, in this summit, to hear what we've been hearing. We have been working for the last 6 months, meeting with various stakeholders across industries, and you heard today exactly what we've been hearing, and you shared today exactly what we've been hearing. And it's so good to hear it validated from you, from our panelists. Really, if we can sum it in two buckets, if you will, the themes really have risen to the top in terms of cross-cutting needs and common priorities that we're hearing across the sectors that relative to housing. Funding, huge, right? There's a huge need for funding, and that in and of itself needs more exploration. It's just like when someone says, we need more housing, what does we need more funding mean? And we heard a lot of great examples of what people would do with the funding and what you would do if we had more funding. You know, organizational capacity, communication and coordination. The treasurer talked about that today too, hugely important. Or partnership, that's what this is about. Anthem is doing some excellent work as a private partner to partner with our communities. And those are the types of efforts we need to see more of. Innovation, all of these solutions coming to the table. And then our common priorities as we move through and consider what an equitable recovery looks like. Everybody's been pointing to similar priorities, and certainly there's a lot of different ways to get things done. And we talk about that in our different ways that we would use our funding and the different ways that or the different policies that we think can support us. But really what this will do is tomorrow, we're going to hear really kind of solutions that we can consider or are considering here in Nevada that really address an equitable recovery for Nevada. And I think really your engagement today is important, and tomorrow just as important, because we need your help to prioritize the actions for housing that impact education. And I can tell you, Tammy was there. Tammy, you weren't in all my other conversations, but everybody was saying the digital divide in education, we've got to invest in. And I'm like, wow, this is a bunch of housers saying that. But you can just see, right? We hear health all the time, Mike, business. We need good jobs. We need to be able to train our workers. So the intersections are so strong and powerful, and that's why everybody's voice is so key. So I just appreciate everyone on this panel. Elaina, thank you for being part of the conversations and for today. This afternoon, Charlotte, if you want to just pop up the afternoon sessions real quick. Do come at 12:30 today. We're going to be moving you into the rooms early, so feel free to come early. Thank you, Charlotte, for handling our technology yesterday. But at 1 o'clock, we have two amazing sessions, breakout 5 and 6. Housing is community, and affordable housing is more than a rental. Housing is community, we heard it today. Lisa, you talked about it, right? Really those wraparound services and embracing them more as we consider housing options, kind of blending those models. And we're going to hear from an awesome Nevada group doing things differently, and also from out of state, and hear some ideas that they bring to the table around permanent supportive housing. Affordable housing is more than a rental, the American dream, right? So of course, in affordable housing, we typically talk about rentals, but we want to acknowledge that most of us have the American dream, and additionally, from a social and racial equity perspective, home ownership is the #1 way we build wealth in this country. So what does that look like, and what are the programs we have to help make that happen? At 2:30, again, we're going to close out the day with incredible session, Let's Build It. I know there's awful lot of interest in this. In fact, this session is going to go until 4 o'clock. Hillary, our moderator, has put together a stellar panel for all of you that signed up. And it's going to be technical for sure, but an awesome opportunity to hear how these packages come together and the layers. I think Audra Hammernick from Nevada Hand, I often hear her talk about it, the lasagna that needs to happen to be baked in order to build these affordable housing projects. So we're going to meet some of our key partners to get these done. And then breakout session 8 is going to be super fun. Katie Coleman from Nevada Rural Housing Authority has a really interactive and fun way for all of us to get to know all the resources we have for housing. And there are so many. I sit in so many meetings where I'm like, wow, don't those people know about such and such organization or this one? So to bring people in the room so that we can make sure that we're referring well, we can identify gaps, or we can enhance our existing programs and we're not duplicating as we move through the recovery cycle, right? So I look forward to joining you all this afternoon. And thank you again, panelists, and thanks everybody for, and Elaina, thank you for moderating. Thank you to Treasurer Conine, of course, Congresswoman Titus for kicking off our day, and look forward to the afternoon.
Thank you. It was an honor.